Okay, so what exactly was your role there in Babylon?
So Babylon, we were AI researchers. We were helping them to localize the product. And localization essentially means ensuring that it's safe and appropriate because we use terms here that are used very differently compared to the UK. So making sure that, for example, those things were appropriate. I mean, easy things as well. I can give some easy examples like the ambulance code may be different, where you refer patients to may be different. So we were there to make sure that all these things were appropriate and the necessary changes were made.
Okay, so for the viewers who don't know what Babylon Health is, what is Babylon Health?
So Babylon Health was a tech startup. They scaled greatly. I think they had IPO'd as well. So at one point in time, I think they were the largest clinical AI startup by capitalization. They had a number of products. So the ones that people know of were the telemedicine products that were made available, especially in the UK and in the NHS. They had a symptom checker. So it's an online symptom checker or an app-based symptom checker where you answer a series of questions and it will give you the necessary general information around what you had around your responses.
Okay, yeah. So Babylon Health was at one point seen as the future of an AI-driven healthcare, right? With millions of funding and rapid expansion to many countries. And at one point, I think they were valued at $4.2 billion before they came crashing down. Now, you had the opportunity to be working in it. What do you like? Did you see it coming? Like, what was it like for you?
So for context, I left them fairly early on, not super early, but before they went into the US, I'd already left them. I don't think that there was a sense that they were going to run out of money anytime soon. There wasn't a sense that things were badly run. In fact, they had some really good leaders in there. So when I look back at it, before I left, I didn't have any red flags. I wouldn't have said, this is not exactly what I want to do. I don't have confidence in it. I just had a better offer somewhere else. But at Babylon, when I look at it after I left, so this is obviously public information. This is my own opinions. It's not based on anything that I had seen or experienced before. When I look at it, I think there was some issues, particularly around the US expansion, because it was, in my opinion, they hadn't innovated on the reimbursement. So it's still from what I understand, it was still a capitation model, which is fairly difficult to make good revenue on, to make good profits on. So I think there was some probably difficulties in cracking the big US market in terms of how do you make a profit from running these businesses.
What is a capitation model?
So in insurance, by and large, you have two major models. There are a few others. You have fee for service and a capitation. So fee for service is basically a pay-as-you-go model. If you pay for the services that are rendered and used, so consultation fee plus, let's say, a blood test plus, say, an X-ray, you would pay a fee for each of these, okay? For capitation models, it's one size fits all. This is the cap. This is essentially you get paid, let's say, 20, 30 ringgit, and that's all you're going to get. That's all you're going to get paid. The minutiae are different, and I don't mean to say that 30 ringgit will cover your X-ray and your blood test and everything, but within a simple consultation, you would have a capitation, so you are only allocated that amount that one can claim. Of course, there are appeals, there are different processes. So obviously, a patient who has, let's say, end-stage renal failure is going to have a different capitation compared to a patient who's coming to see you for a minor ailment, let's say like a headache or a cough and cold.
Before we dive back into this incredible conversation, there are a couple of exciting opportunities with disruptive doctors that I want to share with you guys. First, if you're a doctor who's thinking about moving into a non-clinical career but don't know where to start, or even if you're a doctor who's on the fence thinking if you should leave medicine or stay, the non-clinical career pathfinder by Disruptive Doctors is designed specifically for you. The problem why we doctors think that there's no opportunities for us out there is because we've been trained in sick care all our lives, but that's not true. Healthcare is a huge ocean. What you learn in this workshop is discovering yourself, where to find all the opportunities within healthcare, your game plan, and insights from me and Vivek on how to do it. And the best part is it comes with a 14-day guarantee. By the end of this workshop, you gain so much clarity on what you need to do, or if staying in medicine or leaving for non-clinical practice is for you. Our proven framework has helped more than 1,000 doctors on finding a fulfilling career. So stop wasting your time trying to figure it out all on your own in the dark. So sign up for our next workshop on our website. Next, mark your calendar for Disruptive Doctors Annual Conference and Exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025. And finally, if you haven't already, please download the Disruptive Doctors app. It is a global hub where you can connect, collaborate, share experiences with doctors across the globe, and you don't have to be limited by geography. This is more than an app. It's a movement. So be part of the community of doctors who are impacting healthcare differently. And also, can you do me a huge favor? If you have not subscribed to the channel yet, please be sure to subscribe because it's subscribers like you that help us bring better guests for you. So whether it's the workshop, the conference, the app, or just subscribing to the channel, be sure to do it now. Now, let's get back to the conversation.
Join Disruptive Doctors. Oh, Disruptive Doctors. Impact.